So let's begin with the next topic, nutrition advice for a patient with diabetes mellitus. So first, what is the definition of diabetes mellitus? It's a group of metabolic disorders characterized by chronic hyperglycemia due to defects in insulin secretion, insulin action, or both. So what will be the objectives? That achieve and maintain normal blood glucose level, maintain ideal body weight, prevent acute complications such as hypoglycemia, ketoacidosis, prevent long-term complications such as retinopathy, nephropathy, neuropathy, CVD, ensure adequate nutrition and quality of life. Talking about the dietary principles, there are 5 pillars. Controlled energy intake. Adjust total calories to maintain ideal body weight. If a person is overweight or obese, advise them to create a calorie deficit. Next is balanced diet. All essential nutrients in appropriate proportion. Carb, protein, fat, vitamins, minerals, fibers. Controlled carb intake. Prefer complex carbohydrates with low glycemic index. Spread carbohydrate intake evenly throughout the day. Adequate protein, 15 to 20% of total calories, include high biological value proteins. And restricted fat intake. Total fat, 20 to 25% of total calories. Saturated fat less than 7% and avoid trans fat. So these are the dietary principles: fat, protein, carb, balanced diet, controlled energy intake. What is the distribution of macronutrients? It is carb will be 50 to 60%, fat will be 20 to 25%, and protein will be 15 to 20% of the total calorie intake. Okay. Prefer MUFA and PUFA oils like groundnut, mustard, rice bran, sunflower, soybean. Avoid ghee, butter, vanaspati, coconut oil, excess fried foods. Okay, so this is the primary nutrition advice for a patient with diabetes mellitus. Now specifically, if you have to mention food to prefer and food to avoid, so what will it be? Cereals and millets, which includes whole grains, pulses and legumes, all dals, chana, rajma, etc. Vegetables, non-starchy vegetables, green leafy, cucumber, tomato, carrot, beans, cabbage. Fruits, low GI fruits in controlled proportion. Guava, apple, orange, papaya, pear, berries, pomegranate. Milk and milk products, skimmed oat milk, curd, buttermilk. Paneer, low fat. Fats and oils, limited quantity, prefer MUFA and PUFA as we discussed earlier. Others, plenty of water. Sugar substitutes if needed. Herbs and spices. Tea, coffee without sugar. Foods to avoid: sugar and sweets, table sugar, jaggery, honey, sweets, chocolates, sugar-coated items, refined cereals, maida, etc. High GI foods like white rice, poha, noodles, instant noodles, mashed potato. Fats like ghee, butter, vanaspati, coconut oil. Fruits, banana ripe, mango ripe, chiku, grapes. Beverages, sweetened beverages, soft drinks, alcohol. Others, excess salt, pickle, papad, chips. So these are the foods that have to be avoided. Then there is a meal plan which can be followed throughout the day. It is divided into 7 parts: early morning breakfast, mid morning lunch, evening snack, dinner, bedtime. Okay, and here are the examples. Lifestyle advices: maintain an ideal body weight, exercise regularly, more than 150 minutes per week, monitor blood glucose regularly, take medication insulin as prescribed, stop smoking and avoid alcohol, manage stress, yoga, meditation, adequate sleep of 7 to 8 hours per day, regular foot care and eye checkup, as there is high risk of developing DM food later, periodic medical checkup. Carbohydrate choices: we talked about low GI index, low glycemic index food and high glycemic index food. So what are these? Low glycemic index food is whole wheat, oats, brown rice, barley, millets like jawar, bajra, ragi, pulses, non-starchy vegetables, and most fruits like apple, guava, orange, pear. High GI foods are white rice, maida, rava, poha, instant noodles, potatoes, cornflakes, sugary foods, sweetened beverages. So these all are strictly to be avoided. Plate method is as we discussed, and this is the summary of it. So this was all about the nutrition advice for a patient with diabetes mellitus. Thank you.